Hi, this is Mr. Sales. I'm a soft tissue knee surgeon. Thank you for visiting my website. Today we're going to go through a short presentation about the meniscal anatomy and function. I hope you find it useful.
Each of your knees has two C-shaped pieces of cartilage that act like a cushion between your shin bone and your thigh bone. These are called the menisci. The medial and lateral meniscus have slightly different shapes. The lateral meniscus is more rounded than the medial meniscus, which is more like an open C shape. Although in lay terms the meniscus is sometimes referred to as cartilage, its structure is very different to the smooth cartilage that covers the bone, the hyaline cartilage. The meniscus is made of a specialized cartilage called fibrocartilage. Fibrocartilage is tougher and contains more fibers than other types of cartilage in the body. The collagen fibers are woven into dense tissue that is resistant to stretching and deformation in various directions. This makes fibrocartilage excellent for cushioning the knee joint. It also contains proteins called glycosaminoglycans, which can retain large amounts of water. The fibrocartilage of the meniscus contains a small number of cells, such as chondrocytes and fibroblasts, which are there to produce the proteins and maintain and repair the structure of the meniscus. The meniscus has a limited blood supply. The vessels enter the meniscus through the capsule on the outer side of the meniscus. We divide the meniscus into 3 areas depending on the vascularity of the meniscus and its ability to heal. The red zone is the most peripheral part of the meniscus, where there is good vascular supply. Tears in this area have the best potential for healing. The white zone is the most inner aspect of the meniscus. There is no blood supply here, and the meniscus can't heal in this area. The red-white zone is an area of transition with limited vascular supply, but some potential for healing. The menisci are a very important structure of the knee. They improve congruency of the joint, allowing better distribution of the forces passing through the joint. They serve as cushions to decrease stress caused by weight bearing and forces on the knee. They work like shock absorbers, supporting the load by compressing and spreading the weight evenly within the knee. By increasing the area of contact inside the joint by nearly 3 times, the menisci reduce the load significantly. When the meniscus is removed, there is less congruency of the joint, and the forces concentrate in a smaller area of the hyaline cartilage, which can lead to cartilage breakdown and arthritis of the knee. As weight is applied to the menisci, they are compressed and forced to expand out from between the femur and the tibia. However, the circular design of the menisci provides circumference tension, referred to as hoop stress, to resist this extension and provides stability as the load compresses. The menisci also play a significant role in knee stability. In injuries to the anterior cruciate ligament, the main restraint that prevents the shin bone from moving forward, the menisci become secondary restraints to anterior displacement. However, they are not designed for this role, and they can be damaged in chronically ACL deficient knees. We divide the meniscus into thirds: anterior, middle, and posterior thirds. Tears of the posterior and middle thirds are the most common. The meniscus is securely attached to the shin bone by strong ligaments which originate from the meniscus ends. These are called meniscal roots. Anteriorly, both meniscus are connected by the intermeniscal ligament. We can see here how the medial meniscus is firmly attached to the capsule. The lateral meniscus is more mobile and is loosely attached to the capsule in the anterior 2/3 and posterior third. In the popliteal hiatus, the meniscus is separated from the capsule by the popliteal tendon.